This Good to Go segment is sponsored by Spectrum Health Medical Group.
This week, as we celebrate the life and legacy of Dr. Martin Luther King Jr., it's a good time to remember that one of his missions was to address the inequities in health and healthcare. Dr. King famously said, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." Well, here today to talk about health equity and the work that's happening around it in our communities is Lynn Todman, Vice President of Health Equity at Spectrum Health. Hi, Lynn.
Good morning. Good morning.
Tell me, what is health equity? What does that mean?
Health equity means that there are no unjust, unfair, or avoidable differences in health among different communities and groups of people. It means that everybody, regardless of your racial, ethnic, or gender identity, whether you live in a rural or urban community, whether you are wealthy or not, you're able to live well and experience an optimal level of health.
So it is not about making sure, or only about making sure, that historically underserved populations have access to quality healthcare and regular checkups. It's greater than that, right?
It is, and it's important to note that those things are important, but they're not enough. What we know is that most of health is made outside of the healthcare system. Most of what contributes to health happens in our neighborhoods, in our workplaces. It depends on health, depends on the quality of the housing that we live in, whether we have easy access to nutritious food, efficient transportation, clean air and water. Those are the things that contribute to health and health equity.
So how do we achieve that?
Achieving health equity, that's a tricky question in this country because we haven't been able to sustain health equity. We've been able to implement projects that make incremental improvements, and that's important. But one of the most instructive examples of how we can achieve health equity is the 1964 civil rights legislation and the subsequent enactment of Medicare, which made it illegal for hospitals who are receiving federal dollars to segregate. And as a result of those two pieces of legislation, within months of their enactment, more than 90% of the hospitals in this country were desegregated. And after that, in the wake of that, we saw significant improvements in Black infant health outcomes. So that's one example of the kinds of things that can be done to improve health equity.
What's happening around health equity at Spectrum Health?
We're doing a lot of great things at Spectrum Health. We are shoring up our internal data processes to make sure we can identify actionable disparities. We're reforming our organizational culture so that it embraces human diversity. We're developing programming in areas like housing and community safety and maternal and infant health and cardiovascular health. That's just a very small snippet of the things that we are doing.
What advice do you have for folks who may want to understand better or to work toward health equity in their community? What do you say?
Yeah, I have two pieces of advice. One is to be in relationship with the people who are experiencing inequities and include those individuals and communities in the problem solving and evaluating the results of the solutions. The other thing I would say, and Dr. King embraced this concept of allyship. This work cannot be done in silos or alone, and it takes all of us with all different kinds of worldviews and perspectives and life experiences to come up with solutions to something as complex as health inequity. So those would be my two pieces of advice.
All right. Well, terrific advice. Such an important topic of conversation and critical work being done. Thank you so much, Lynn, for spending some time with us today.
And thank you for having me.